Our next speaker is Mr. Darrin Gall.
Thank you for allowing me to speak and requesting that Council will review information on fluoridation as a public health initiative. So what are we adding to our water? We're adding hydrofluorosilicic acid or sodium silicofluoride, which is classified as a toxic waste by the Canadian Environmental Protection Agency and the government. It's produced predominantly by the phosphate fertilizer industry. So it is a waste stream toxic byproduct that we are adding to our water. It is not naturally occurring calcium fluoride. And I want to make clear, I'm not debating whether calcium fluoride is beneficial to teeth. There's clearly some evidence that it is. What we're discussing is whether we should be forced as citizens to swallow it. So here's the relative toxicity of fluoride to lead and arsenic, just slightly more toxic than lead, which you have spent a lot of money trying to remove from the water, and there's evidence that fluoride enhances the uptake of lead. Now, fluoride gets a strange little pass. We only allow 15 parts per billion of lead and 10 for arsenic, but we allow 1,500 parts per billion of this industrial waste compound in our water. So how much is safe? Fluoride persists in the environment, and there's evidence that it is increasing in our rivers. It would be illegal to dump this compound in a river. But by dumping it into our water supply, it ends up in our rivers anyway. So it's a very strange kind of product, and I appreciate how difficult it is for councillors to have to make these kinds of decisions. But it is an industrial waste product, and it is damaging to the environment. British Columbia does not fluoridate, partly because of suspected damage to fish populations. And the great majority of Canada does not fluoridate, actually. And we have studies from many cities showing that the cavity rate question is questionable at best. So how much is safe? For something like lead and arsenic, it's really considered 0 as the optimal amount, but for fluoride, we give it this special pass. So who decides? It is a fundamental human right, the right to informed consent. And I would argue that this is a clear violation of that most basic human right. National Institute of Health, one of the largest peer-reviewed databases and well-funded databases in the world, has this to say. It says it's a violation of medical ethics and of human rights. So that would end that basic little spiel. But I would add, recently, University of Toronto released a report showing that fluoride is actually a neurotoxin. And there have been many reports showing that fluoride is a neurotoxin. So what you're saying to mothers is that they must ingest a known neurotoxin, whether they agree or disagree. And I feel that that is just unacceptable. As a citizen, I'm asking, I feel I'm one of those that is sensitive to fluoride. I'm asking, please respect my human rights and stop. Because if I want fluoride, I have multiple sources that I can get it. So the source of fluoride from the phosphate fertilizer industry is worth about $30 million a year in Canada. So clearly there is a bias, and I would argue that most of the sort of expert opinions comes from lobby groups from that industry. We have an excellent toxicology department at the University of Saskatchewan here. And I would suggest we talk to toxicologists, not dentists. Dentists seem to be compromised and are certainly not that well informed on toxicology. So I would, if you have any questions about what I'm saying or your citizens are saying, the University of Saskatchewan Toxicology Department is a great information resource. Thank you.
Thank you, Mr. Gall. I see a question from Councillor Hill.
Thank you, Madam Chair. Mr. Gall, thank you for being here today. This is certainly an item that you're very passionate about. So I've heard from you on a number of occasions on this.
Yeah, I can't believe we're back.
You mentioned British Columbia. Is it the entire province that doesn't fluoridate?
I can't say that with certainty, but definitely Vancouver. It's most of the province. So, for example, just under 70% of Alberta fluoridates. Most of British Columbia, I would say maybe there's one community or two that still does. But we have excellent data comparing cities and nations. Denmark, as a nation, has never fluoridated. Most of Europe does not. And we have evidence showing that their cavity rates are the same or lower than
I'm
ours.
going to bring you back to another comment you made, that most cities in Canada do not fluoridate. You just mentioned you have the data. Do you have that data showing the municipalities in Canada that do fluoridate and those that don't?
I don't, but I could get that for you.
Okay. No, that's fine. I think our administration in a report had gathered some of that data. Are you familiar with the information from Calgary since they quit their fluoridation and what the results have been in terms of the cavities or the health results? Were there studies done after that? Had you researched that?
Yeah, well, one of the big reports that got a lot of media attention was the McLaren report recently. And she states, Lindsay McLaren is the president of the Alberta Health Association, and they strongly endorse fluoridation. But she states in a National Post article, I do not feel that some of the media coverage, I do feel that the media coverage made it out stronger than it was. And she also says in the same article, much of the media coverage suggested McLaren had statistical proof, something that she notes could frankly only come from a randomized clinical trial where scientists create a controlled experiment. Hers was an observational study which can never demonstrate a causal link. And if you actually read the report, it says it was not statistically significant. Depending on how you interpret the data, Edmonton and Calgary have similar cavity rates, as does Regina and Saskatoon.
Okay, thank you. I appreciated your comment, though, too, that we should be speaking to health professionals and not dentists on this.
Toxicologists, chemists.
Yeah. And final question, and you may not know the answer to this, but your research indicates that you might have some indication. You made a statement about if you want fluoride, there are multiple sources where you can get it. I understand that part. Are you familiar with municipalities that have discontinued fluoridation and that had of any programs or services that they had provided as afterthought to help maybe the more marginalized sector access fluoride to address those concerns that people have when you remove it from the water system?
That's a good question. I don't know. Waterloo was one of the major cities in the recent past that discontinued fluoridation, and I do believe that they advocated some funding for disadvantaged groups, because clearly that is where the benefit lies. Any money spent on helping people get access to dental care is money well spent. I would argue that putting industrial waste fluoride compounds is money down the drain in a way.
Okay, thank you, Mr. Gall.
Okay.
Your Worship?
Yeah, and I just wanted to also ask a couple quick questions, Mr. Gall. Thank you, and I also, we talked about this in the past, and I appreciate that you
I appreciate this opportunity as well.
Working for this for some time, but what I have suggested to you is that one of the issues that City Council and City Councilors face is that we're not public health experts, and so have you engaged I guess it's now the Provincial Health Authority or the former Saskatoon Health Region, and presented your findings to them to discuss the concerns that you have, because we do defer in many cases to our public health authorities and others to help sort out some of these issues where there's lots of information out there on both sides of the issue.
Well, it's a difficult for me to engage at a provincial level, I find. I mean, I've had some emails, but I found that it kind of went silent after a while, especially once I brought up, legal issues. They just dropped it, and I guess that was a bit of a mistake. But I would say that City Council is being put in a position that you really shouldn't be put in. You are being asked to approve or not on an issue that is really beyond a council decision. I agree with that, but that decision is being given to you. And I would argue that's really a way of protecting interested parties legally. Like, no one seems to be legally responsible here. Health Canada, kind of defers responsibility to the provinces to council, council back to the provinces. So it just becomes this loop. But I would sort of bring it back to the whole idea of human rights. It wasn't long ago in this province when it was considered okay to take children away from their parents. And I'm sure there were experts advising on what a great idea that was. So sometimes we have to make decisions based on the human rights issue and try and balance these things. I realize nothing's absolute. Common good is important, and protecting people's teeth is a very important and noble cause. I just feel that this method is morally and ethically flawed, and there's evidence to support that.
Okay.
It's a medicine. So informed consent means I should have to give consent. I'm not. And half the population probably wouldn't.
So, and I understand, and you've made that, levied that argument to me in the past as well. At the same time, it's been named as one of the top 10 public health innovations of the of the 20th century as well. So that's the dilemma we face, is that there's arguments to say that it makes a real difference, particularly in low-income communities. So we're not here to debate it, Mr. Gall.
Okay, but I would say that anyone can make a statement, but the facts do not support that. That's an outrageous statement, actually, made by supporters of industrial waste fluoridation.
It was a public health body that made that statement. So thank you.
It's not really meaningful.
Thank you, Mr. Gall. Are there any further questions for the speaker? Nope? Okay. Thank you. I do have a few comments. I reviewed the literature you provided and also
More too, if you want.
That's good. Thank you, Mr. Gall. We've got what we need. Yes, I reviewed the literature and have read the studies reporting on the results comparing Calgary and Edmonton. And I think what's important to make sure is clear is that while the data on permanent teeth, which most of us refer to as adult teeth, is not demonstrated to be statistically significant in terms of the number of caries or dental disease observed, the dental disease difference in baby teeth is significant. And for me, that's where the concern lies, is among young people in our community who may not have access to dental care. And for me, the line has always been, if the province decides to reinstate the school dental program or provide universal dental coverage for residents in our community, I'd be interested in having this conversation again. But unfortunately, the access to dental care is not equitable in our community. And until such time as it is, I see this as an important measure to prevent the unnecessary dental disease among our youth. I'm seeing a few more comments here, so I'll turn it over to Councillor Hill.
Thank you, Madam Chair. Mr. Gall, you said you had more information. You can submit that to the city clerk, and she will forward it to us as well if you have additional stuff you'd like us to get.
Yeah, I have some information on the neurotoxicity of fluoride. Children are sensitive to neurotoxins. There's a startling increase in ADHD and autism that's inexplicable just by diagnosis.
Sorry, Mr. Gall,
Okay.
I wasn't opening it up
Okay,
for additional comments, just suggesting you can send the information to us.
Thank you.
Thank you.
That'd be great. Thank you. Your Worship.
Well, I just wanted to clarify that the body that recognized water fluoridation as one of the 10 great public health achievements of the 20th century was the Center for Disease Control and Prevention in the United States. And so that's the basis for that finding. And that's what we find ourselves in between.
Great.
I just wanted to clarify the source for that.
Thank you, Your Worship. Are you willing to move the recommendation that the information be received? Okay, the recommendation has been moved. I'm not seeing any further comments from the committee. I am. Councillor Hill.
Just a point of order, Madam City Clerk, we don't have a pending report on this item at this time, but can we still attach it to the file? Because we did have a report in the past on it. There's some information in here that Mr. Gall has provided that I think the administration could review next time that we do review this item. I expect that it will happen at some point in the future.
Yes.
Great. So I will also move that it be attached to the file.
Great. So we have 2 recommendations to receive the information and append it to the file. I don't see any further discussion. All in favor? And that's unanimous. Okay, we do have one more speaker, Mr. James Wood, President of SOS Elms Coalition. I think I saw him earlier. You've heard the instructions to speak, and I know you've been here a couple of times before, so whenever you're ready, you're welcome to begin.
Okay, thank you. I wanted to make a few comments. Who are we? You're